Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.
I'm Roby Brock with your Talk Business Arkansas Daily Update. There was a lot of action at the state capitol today, again on Medicaid and that debate as it moves forward. Also, there was another override of the governor's veto on a pro-life bill. Let's run through today's political action. One day after the Arkansas House of Representatives overrode Governor Mike Beebe's veto of an abortion limitation bill, the Arkansas State Senate followed suit. On a 19-14 vote, state senators agreed to override the veto of House Bill 1037, a bill that would restrict abortions after 20 weeks. 18 votes were needed to override the veto. The bill will go into effect immediately now that both chambers have overridden the veto, as it has an emergency clause provision attached to it. Senators also passed Senator Jason Rapert's Senate Bill 134, known as the Fetal Heartbeat Act. It would prevent abortions after as early as 12 weeks. The bill passed 26-8 and now heads to Governor Beebe's desk for signature or veto. And after this word from our sponsors, we'll run through our biggest business headlines of the last 24 hours, and I'll sit down with Senator David Sanders. We'll talk about the action in the Senate today and what may be happening on the Medicaid front. I'm Roby Brock. This is Talk Business.
I don't think it's going to be an easy conversation because they are very strong-willed. I think it's going to be important to us that we know that you're somewhere in a facility that looks after you, has compassion, has care, and you respect it. I mean, I'd love to look after them, I'd love to be able to take care of them, but I don't think I could. That'd be a wrong choice on my part.
Arkansas's skilled nursing and assisted living centers provide quality care for our seniors.
Farm Bureau helps protect its members in more ways than you might think. They've always been the voice of agriculture in Arkansas, working on behalf of folks like me when nobody else would. And Farm Bureau stands for the values that Arkansas families care about. They've protected my right to farm and make a living, which helps everybody who likes food on the table. You know what they say, Arkansas counts on agriculture, and agriculture counts on Farm Bureau.
The Arkansas State Chamber of Commerce and Associated Industries of Arkansas. The State Chamber AIA is the leading voice for business at the state capitol and serves as the primary business advocate on all issues affecting Arkansas employers. Our mission is to promote a pro-business, free enterprise agenda and prevent anti-business legislation, regulations, and rules. Now more than ever, business matters. Learn more at arkansasstatechamber.com.
Well, let's run through the biggest business headlines of the last 24 hours, starting with Axiom. A spokesperson for Axiom Corporation confirmed that the Little Rock-based database giant has laid off workers as it corrects for market conditions. However, the number of layoffs represents less than 3% of the company's Arkansas workforce. Talk Business Arkansas has learned that less than 50 associates were laid off Wednesday in Arkansas and less than 100 company-wide. An internal memo from Walmart U.S. CEO Bill Simon circulated throughout the company Wednesday, announcing that Tom Mars, Executive Vice President and Chief Administrative Officer, will exit the company on March 13th. There was no reason mentioned in the memo for Mars' departure. Mars has been with Walmart for 11 years, according to the memo obtained by our content partner, the CityWire. He's a former director of the Arkansas State Police. Tyson Foods, the nation's largest meat processor, says pending budget cuts, or the so-called SEQUESTER, threatens to disrupt its supply chain. Trade groups have been vocal about the impact on meat inspection, as the U.S. Department of Agriculture and its Food Safety Inspection Service will face worker furloughs if the $85 billion in cuts take effect on Friday. Tyson's chief operating officer said that the meat inspection is mandated by law and a federal requirement. And of course, you can keep up with all of these breaking business and political news stories on our website at talkbusinessarkansas.com. After this word from our sponsors, I'll sit down with State Senator David Sanders. We'll talk about the override of the governor's veto on the pro-life bill today in the state Senate. We'll also talk about Medicaid, which, as you well know, has gotten to be a lot more complicated or perhaps simplified. I'm Roby Brock. This is Talk Business.
Noble Strategies is a bipartisan state and federal government affairs firm with a successful track record of providing effective advocacy for business, government, and nonprofit entities. Noble Strategies provides service in areas such as lobbying, public affairs, trade association management, and marketing campaigns. Learn more at noblestrat.com.
I was looking for a bank that could best protect my finances.
That shared my passion for my business's potential.
A bank that offered investment expertise,
lending support, insurance guidance.
A bank that delivered full financial support.
That's how I found True Balance.
True Balance.
From my bank.
From my bank.
Delta Trust and Bank, the expertise to meet all your financial needs.
One of the real advantages of electric cooperatives membership is having a voice in our state's energy future.
Not a week goes by without important energy issues making headlines. These are issues that need to be discussed. And you should know that as policies are being developed, the cooperatives are looking out for our members, advocating what's best for you.
We are your friends and neighbors.
We are your local electric company.
The electric cooperatives.
We are Arkansas.
I'm joined now by State Senator David Sanders, Republican from Little Rock. Good to have you with us. Thanks for being here.
Oh, it's great to be with you.
All right, let's talk about what happened up in the State Senate earlier today. You guys mirrored what the House did, overriding a governor's veto on Representative Mayberry's pro-life bill. Was there some dialogue as to how this might happen, or did you guys have any concerns that you might send a signal to the governor that, hey, we're not working with you? Just tell me what the conversations were about it.
I mean, as far as any conversations that took place, I certainly wasn't part of any and didn't know of any. I think it was the governor's action required action on our part. Obviously, the House took action yesterday, and I guess it was our turn to take action on the bill, and we did. If you look at how it passed, both chambers early before it went to the governor's desk, I think there was broad support for it. Obviously, the margins weren't as high either in the House or in the Senate, but it did pass.
Yeah, why do you think that was? What kind of goes into the psychology there on that?
I don't know. I mean, again, I suppose for a Democratic member who, you're essentially responding to a veto of your governor, Democratic governor, so I wouldn't speculate in terms of the thoughts that are going through their head or the reasoning was, but I mean, I think just from a sort of a setting back and looking at it, I think that's probably what had something to do with a few of the initial yes votes turning into no votes, or in many cases, not voting, period.
I don't think it's going to take a political rocket scientist to figure out that Senator Rapert's bill is going to have constitutional problems with the governor if he had problems with Representative Mayberry's bill. That bill could be coming back to you guys for a veto override as well. You think it passes with an override?
I would suspect so.
All right. That's your prediction? I'm putting you on the record with
Yeah, I mean, again, you look how it passed the Senate.
Yeah, 26-8 today.
Yeah, and again, now it has been amended, I think, to deal with some of the concerns that had been expressed in the House. So I wouldn't see any reason why we did amend it today on the floor, and it comes. So
let's segue to Medicaid. We've had a little bit of a shift in the conversation up here. I've been joking around with a couple people. Yeah, I've been having a little bit of a conversation with some folks. Do we call it Medicaid expansion anymore?
Well, so here's what's most important, I think. I don't know that what we call it, if that really matters. I think what we're looking at now is what we're discussing in terms of what it does, it being what the Obama administration came back and said that they were willing to do. Now, let's step back. You and I have covered this. I suppose the people that watch this are the insiders.
Right.
And so they know everything that has really happened since the Supreme Court came down with their decision. Put everything back on the states, and essentially what has happened is Republican lawmakers, and to a certain extent, maybe a few Democratic lawmakers, although it hasn't been public, have said, wait and see. What does this mean? What are other states going to do? And then so that we went down that path into the fall. We get here. December, January, obviously those proponents of full expansion line up. We're told we have to do it, and all the reasons why we have to do it. We had questions, legitimate questions,
right,
and had been engaging with the administration on various levels, not just on the issue of what do we do now with the situation that we're given, or moving forward with potentially adding people to the Medicaid rolls and growing a system that's broken, but also we've been engaging them on possible reforms of the current system.
Yeah.
So that has all been happening together.
Let me fine tune this a little bit. Do you like what you've heard, that they can take Medicaid money and basically cost shift it into this private health insurance exchange that's going to be created under the Affordable Care Act? Do you like that flexibility that you've gotten?
Yeah, I suspect I liked it because I asked the question of whether or not we could do it. And so what I think is what is good for us in terms of the policy discussion, we're having a meaningful policy discussion now about what we can do. So let me tell you what it doesn't do. What they have sent back to us as possible options. One, doesn't grow the Medicaid rolls in the state of Arkansas, traditional Medicaid rolls, which we know is bloated. We have a lot of people on, straight up government assistance, and so that doesn't happen. What we also know under the plan that they floated, what also doesn't happen is that we are not going to be in a situation where we're disincentivizing work. That's been a big concern of mine. Is sometimes we've been around a long time. Great intentions don't always end up with good application, or they're not executed correctly. And I think a lot of times we can look at social welfare programs and say, what we have done is disincentivized work. So what they've handed back to us doesn't disincentivize work. What they've also handed back to us also will actually reduce Medicaid rolls in the state of Arkansas, both immediately and moving forward, looking at possible options for waiver programs that we have. So we're actually looking at potentially reducing the Medicaid rolls. One, what they've given back to us, I think, ensures a better level of care. I mean, there's studies that have been done for years showing the level of care, both nationally and in-state, on Medicaid. I think everyone agrees that private insurance is a better option for people. And what it also does is it gives, it just literally gives people an option.
Yeah.
Because what happens is this, so this is very dynamic. So when we're talking, to our friends in the administration, it's literally what has happened as a result. A couple things too. One, every Medicaid state director in the country, maybe everyone is an overstatement, but several Medicaid state directors have been calling saying, what in the world did you guys
pull
get?
That off? Yeah.
Secondly, the other thing that's happened is you have a number of insurance companies who aren't presently in Arkansas. Now I'll tell you why this is important, that are calling now saying, hey, we've heard about what you are now talking about as options.
Yeah,
because
there's the possibility there'll be a population of 250,000 people that could somehow opt into private health insurance.
And the benefit, and everyone knows the benefit of that. So if they're coming in here to look at that, they're going to look at possible other options.
Right.
The complaint in Arkansas is, when you've had these big debates about, we need more insurance companies in state. We may need to remove the barriers that allow cross-state competition. Well, what this essentially has done, at least initially in discussion, is shown that, hey, maybe others will be interested. That has major ramifications, even on the straight up private healthcare side that's not subsidized through an exchange.
Yeah.
So that's pretty incredible. So, and the other thing that's important, you look at everything that I just described, this is fundamentally different than anything that has been talked about, proposed, discussed as a serious policy option. So the question is, well, how did we get here? Well, we got here because we've been thoughtful, we've been deliberative, we've asked questions. You've probably talked to the governor, you've probably talked to John Seelig, Andy Alsall. I don't think they expected when they asked these questions that they would get the response.
Yeah, no, I agree with you. Director Seelig told reporters in a press conference that he was surprised at the reaction that they got. So we're running short on time.
Okay,
go ahead.
Real quick, and let me give some credit too as well from their standpoint. Just because a group of lawmakers concerned about this asked questions and asked them to go to the table with possible options. They didn't have to do that. They didn't have to do that. To their credit, they did. And I mean, I, for one, am grateful that they did, because now it looks like we have an option that we can really begin to discuss and talk about, and we're talking about the details and all the apparatus, the moving parts.
Give me one example of a detail, a moving part, a piece of the apparatus that you think is pretty crucial to get an answer to that you don't have an answer to right now.
Well, I think we have, I wouldn't say that we don't have answers to some of the details. I think we have sort of a framework for discussion about the details. One, y'all have talked about it, and the churning effect that you've eliminated. So the whole entire discussions about insurance exchanges changes, because it's a fundamentally different transaction taking place in the insurance exchange.
Do you think we need to move to a state-run exchange?
Or I don't know. I don't know yet. But again, I mean, I'm telling you, and I think you've heard others comment, it's a fundamentally different policy discussion now because the transaction is different. And I'll say this: there have been concerns, even by the administration, voiced that even under any model of exchange that you have a lot of elaborate and complex IT systems that are going to have to communicate in this new model. We literally have created new systems out of the ether. There's a big question as to whether or not, when you flip the switch, if that's going to work. Under this model, what we're talking about, that transaction is a lot simpler. That communication is different. So, I mean, I think there's a potential benefit here for us on that. There are other questions in terms of what we're going to be able to do. I mean, my goal is this: I want to provide the highest quality of care at the lowest possible cost, long term, not be short term in anything that we look at. Because look, federal upfront money with also a diminishing federal role, we know that that's there. It is enticing in the forefront. Our problem never is, in any policy decision that's been debated up here for years, Roby, and you've been up here through the whole soda pop tax issue, 1995. That's when I started paying attention to legislative sessions. I think what we have to do is look long term and make sure that what we're doing puts us on solid financial ground. One, that we're doing something that decreases the current Medicaid rolls. Because if you're decreasing the Medicaid rolls, then we can begin to talk about alleviating and eliminating pieces and parts of the bureaucracy, because you have individuals who have the option to go purchase private health care insurance. This idea of assisting people buying private health insurance, it's not new. This is premium support. It's
subsidizing.
It is. So it's premium support, and other states have done it under the global Medicaid waiver. And that was my initial question: is could we possibly, get the global Medicaid waiver and do this? And the response, well, maybe we don't need that. But so this is something that has been done before. I'm interested in providing high quality care, lowest possible cost, long term. Also one that doesn't disincentivize work, that actually helps people move from not working to working. There's a lot of question as to who all these people are, the 250,000 estimates. I think a lot of those people are people who are in fact unemployed. So what you're not creating is what we don't want to create is an incentive for someone to say, gosh, I've got this benefit and I've got this benefit and this benefit. If I go back to work, it goes away. So what we're doing, at least what we're discussing, the possibility, and let me be very clear, this is not a plan. We have a frame of reference for a policy discussion. We have the ability to say we have taken, at least eliminated that, because what happens is now a person has the ability to move, and they have the ability to move into work. And guess what? How much they're required to pay is based on what they're earning. For me, that is a fundamental shift. Forbes magazine has a piece today that talks about what is happening in Arkansas today is a fundamental shift in the public policy discussions about healthcare in the United States. That is happening here in Arkansas. Not because we've come to blows, but because we've sat down, we've listened to each other, we've talked, we've been reasonable, you're talking in good faith. We've done a lot of things to really take the vitriol out of this, and I will credit members I will specifically credit our members who I think the idea of why they were opposed to this had something to do with who was in the White House. No, there's a very practical element to this. Is what we're doing, is what we're deciding, is what we would potentially be looking at, is this in the best interest of Arkansas, not only in the short term, but in the long term? I'm very encouraged. I think we have a very good policy debate happening right now.
You'll be integrally involved in that. I appreciate you being with us.
Thank you very much.
All right, he's Senator David Sanders. You can keep up with the latest business and political headlines at talkbusinessarkansas.com. I'm Roby Brock. We'll see you next week.
Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.